My name is Dr. Aisha Ahmad AA Yousuf. I'm the Medical Director for Reproductive Surgery here in Sidra Medicine. I'm also a physician consultant who is specialized in minimally invasive gynecology and robotic gynecology surgery. I am actually from the inaugural class that graduated from Weill Cornell Medical College in Qatar, and I'm proud to say that. Following my graduation, I went to the United States at University of Michigan Hospital, Ann Arbor, Michigan, where I did my obstetrics and gynecology residency. After that, I had this passion in specializing in minimally invasive surgery, and I was also very passionate about surgery technology such as robotic. So I went ahead and I did a fellowship in Canada, Toronto, where I did specialize in minimally invasive gynecology and robotic gynecology. So right now I'm considered to be the first physician, and specifically the first Qatari physician who is specialized in robotic gynecology. Since I came to Doha, our team had established the Department of Robotic Gynecology, where we started performing lots of surgery via this methodology. For example, we were able as a team to remove big fibroids. So this is one of the examples, a big fibroid that is around more than, let's say, 12 centimeters, via a small keyhole incisions from the abdomen. And this is the beauty about the surgery, because patients recover very fast, the cosmetic effect is much better, and the patient has much less pain from the actual surgery, as well as much less complication by having a robotic removal of a fibroid, let's say. One of the recent achievements that we had in minimally invasive gynecology and robotic surgery is a rare case of congenital anomaly in a 14-year-old girl. This female, who's only 14-year-old, we discovered that she has a rare syndrome where she developed two uteri. So instead of one womb or one uterus, she has two uteri. One is somewhat normally developed, which is the one on the right side. The only difference is that it has one tube as well as one ovary. The problem is with the other uterus. The other uterus is not completely developed. But the issue with it, because it is not completely developed, it continues to bleed inside itself, causing a huge mass inside the abdomen. And because it is not draining to the outside, because it is not fully developed, it caused this mass in the abdomen as well as pain that this 14-year-old had been suffering from. Therefore, this patient needed a surgery to remove this extra uterus that is abnormally developed. Let me show you some of the pictures. So in this picture, you can see the normal uterus, which is in the right side with a normal tube, and actually the ovary was behind it and it was hiding there. But this is the abnormal uterus, which is a huge mass that this patient needed it to be removed. The old style surgery is to do open surgery. Here we were able to do a minimally invasive, so we did keyhole incision, and through laparoscopy, with our team we were able to remove this big mass. Some people question, how do you remove this big mass through small incisions, which is a valid question. We do that by cutting this mass into pieces to get it out from the small incision, basically. The girl had recovered really well after the surgery. Like within 2 days, she was able to go home. She did not notice much because each incision is almost like 0.5 centimeter, and she only had like 4 incisions in her abdomen. So I want to take this opportunity to first thank my team at Sidra Gynecology and Minimally Invasive and Robotic Surgery Center, where we are providing the best care, honestly, to our female patients. I do want to encourage the patient, encourage the female to come and seek at least some opinion about their conditions with us here in Sidra. I do want them to feel trusted about the technology as well as the advanced skills and surgeries that we can provide them for hopefully much better results also in the future.